Continuing with our strategies on dealing with lower back pain and mid-back pain as well, I'm back to that old stand by the side lying position here. So I do hope that you are trying this by now if you have gone through the earlier tapes. I do find this is an incredibly worthwhile way to work on people. The advantage of the side lying for back pain is that you can always keep your person into a neutral position, and yet you can move them frequently enough. If they're lying down in their stomach and you have a pillow under them and then you have to take the pillow out or you have to put in a thicker pillow, they're going to be staying in one position for quite a while, where it's very, very easy for you to mobilize those low back muscles that are in spasm by making small little movements and continuing your work without having to make gross changes in their positioning. So let's talk about the low back here in side lying. The first thing I do is I try to make sure that my client is comfortable, and I ask them to bring their knees forward, I ask them to bring their knees back, and we've got Dina in for her what is a very comfortable position. Now, obviously she's not suffering from an acute flare-up of her back or a chronic flare-up, so I'm going to leave her in this relatively neutral position. But what you may find is if you look at the low back here, that some people may, with their knees in this position, have a very pronounced lordosis, while somebody else in the same position may have their pelvis tucked under. So what you want to do is to create a fairly neutral position for them and work in that. So now I can decompress these lumbars, just working down like this. And what I try to do is I try to determine where is the in range of their comfort. So I'm going to go down towards Dina's feet here and show you how I might work about doing that. So if I worked in a hypothetical position with somebody, I would have her be in a neutral position and not working too much herself, and I'd bring her legs back and say, how does that feel? And she'd say, right there I'm starting to feel some tension. I would mark that, and I'd take a look at that amount of extension in her back there and say, well, obviously this is not the way I'm going to work. I want her to be in a neutral, pain-free position, but I'm going to try to work and change this so that I can bring her legs further back without increasing symptoms later on. And then I would move her forward and say, how do you feel here? Oh, that feels great right there. So that's where I'd start work. The main thing is you want her to relax that back. So I'm going to move her back into a neutral position. I'm going to work from this side so my body isn't in the way. And any work you can do on the gluteus maximus, the gluteus minimus, the gluteus medius, anything around here is almost always going to help low back pain as long as she's in a neutral position. So I'd start with some nice broad strokes. Always trying to decompress this area, but at the same time not moving just the top side so much as you might when you're working with a person that's pain-free, because that's going to put some torsion in the low back. So I am just trying to stretch this area to decompress that lumbar area, but I'm not going to stretch her as much as I might somebody that was pain-free. I'd work up this way. I'm grabbing her hips, so I'm doing a separation stroke now. And I'm trying to free her ribs so she can take a nice breath and move up. That's good. I don't work on any one place too long. I want her to get back into a somewhat neutral position. And now I'm going to move the legs back a little bit and ask, how's that feel? Sometimes that's just enough for her to notice an improvement in in-range discomfort. Next, I'm going to extend her leg. Her pelvis is still in a neutral position, and I want to start working with this IT band here. So all I'm going to do is the same strokes we've been showing you, is I'm going to possibly pull and distract her leg down a bit, but basically soften this IT band. From there, I can start working on the independence of the two innominate bones. Rather than having them both work together here, I can leave her bottom knee forward and bring her top leg back, support that knee, and ask her how she feels there. One of the biggest things you can do is to increase confidence here. So now as I'm getting a little bit of movement, I may be breaking some of those spasms that she has. She's much more into extension here, and she seems to be pain-free. Obviously, this is hypothetical. In this position now, one of the big muscles that I want to deal with is I'm going to come into quadratus. Rather than doing a big, broad stroke with my fist or elbow, I'm just going to use my fingers. And that's about enough time to have that leg back. I want to put her in a neutral position. I most always keep a pillow between the knees here. And now I'll bring in some active movement. This is very important to start recruiting these muscles on her side. So I'm just going to have Dina, can you tip your pelvis forward? Now she's that way. There we go. Now she's into extension much more than she had been before. Maybe she'll learn, oh my gosh, I'm safe to do this. And you just tell them to, okay, and relax that, to only move wherever they feel comfortable. Now tip your pelvis under, and we're starting to use those muscles. They're lengthening and they're shortening where they've been contracted into spasm. So what you're doing is you're working with the neurological processes here. You're relaxing that spasm, and yet you're keeping her in a neutral position. This is about the way I go, and then I try to keep the person relatively pain-free. I always tell them to call me if there's any problems, and they need treatment once a week for 2 or 3 weeks, and then after that time, you can start getting more and more aggressive about the amount of movement you want to move in the back, and you can go into many of the other aspects that we talked about putting more and more rotation. You might move the top this way, you might move the bottom leg back, so that you can start working with rotation here. You can get more aggressive in stretching. You can move rotation in just the opposite direction, where you bring the leg forward and bring the shoulders back and work this way. All of these things that we've talked about in earlier tapes. The main thing is don't be afraid of working on somebody with a low back problem. If you're cautious, if you work on them in a pain-free situation, you can do a tremendous benefit to them. Even if you don't cure a particular disc or something like that, they're going to have maybe just an hour when you've been massaging that they're pain-free and they're relaxed. And that's an awful big benefit to the central nervous system. So don't shy away from working on people with back problems. You can really help them, and you don't have to be an expert to do that. Psoas and iliacus muscles. We've shown the psoas and iliacus at length in previous sections, but do notice how they join together and the necessity of addressing both of these muscles rather than just the psoas when working to create balance in the pelvis and low spine. The psoas has more direct effect upon the lumbar spine because of its attachments to the vertebrae and the discs, while the iliacus affects pelvic torsion problems and the sacroiliac joint. One other safe and effective way to try to work with people that are having back pain is to have them in the supine position and consider working on the psoas muscle. I usually would not work on the psoas muscle the very first time I'm working on someone's back. I'd like to keep the equation simple and not know that I'm possibly flaring somebody up by doing too many things. So if they're improving, that's one time that you can try the psoas work. Say, okay, we're going to get a little bit more complex here and work with this. Or if they're not and you want to try to do some psoas work and not confuse it with the other work, just say, let's try some anterior work on your stomach and see if we can help you that way. Now, I've already spent about close to 25 minutes or so talking about the ways to work in the psoas, and was showing all sorts of movements and moving the legs and stretching this. The one thing I would say is someone is having back problems, that what you would do is just work in a neutral position with the legs supported by a pillow here. So all I would do would be just some very, very gentle work. And you realize that I'm working much faster than I would normally. It might take me 10 minutes to work on this. I would just sink into that psoas, see what it feels like, and just sort of hang out there and see if I can talk it into softening. Before hanging out for 5 minutes or so on somebody's psoas, I certainly would have palpated each side to decide which side needed the work. Remember, the psoas muscle, in addition to attaching to the lumbars, which can cause side bending and rotational problems, also attaches to the intervertebral discs. So I have had a few, maybe 5 or 7 over the years I've been working, people that have had long-standing low back problems, and I go in and I do 10 minutes worth of psoas work and their problems totally go away. So this is something to try, but don't try it too early in your treatment. So I would work this way. I maybe would grab the psoas with my fingers a little bit now, putting my intention through the outer layers of the abdomen here and try to stretch it a little bit. And then, of course, I would balance on the other side. And I might even do, as I've shown you a little bit before, a little bit of balancing work by getting right down. You wouldn't even have to get too deep on the psoas, but this would be recruiting these muscles to work, and then just have Dina tuck her tailbone under, and then tuck it back up into neutral without going too far, and tuck it under, and just see how these are working, and if one's a little more anterior than the other. One other aspect that I would like to cover in dealing with low back problems is the issue of strengthening. So just as with the knee, if a muscle isn't working properly, the knee is not going to track properly. If the abdomen is weak, if certain aspects of the back are weak, then that can really exacerbate low back problems. So I've had a lot of training in this. I've taken a lot of workshops. I worked in physical therapy for about 10 years before getting out in my own practice. So I'm fairly accustomed to this, and this may not be something you want to explore enough. What I find works best in almost all cases is get a great referral base. Get an osteopath that really knows how to manipulate vertebrae, or a chiropractor that of course knows the same thing. Find a physical therapist that you feel comfortable with, that you can refer your patient to, or your client, their patient, to for a strengthening program. And the other thing that's really grown over the last few years that I've had just excellent luck with is find a good Pilates worker. And they are excellent at dealing with the specificities of where a person is weak in their abdomen. And this can be the missing link again. You can do all that soft tissue work, and that in combination with some strengthening can be just enough to make that person turn the corner so that they're able to resume a normal lifestyle. So do get a good referral base and use that. There are some examples of strengthening in my book, and I would say check those out. Those are rather simple and rather safe, and as you find more interest, if you feel good about suggesting strengthening exercises, by all means do that, but realize, again, one person's medicine may be another person's poison there, and I think it's best to refer to professionals for this. When my office phone rings after 9 o'clock at night, most often it's somebody that's been in a fender bender and wants to come in the very next day for what they consider to be a whiplash injury. And this is always a difficult case to call, and I always want to err toward caution on this. One thing that I rarely do is work with somebody that's had a whiplash injury until at least 2 to 3 days have elapsed. One of the things that can happen is right after the injury, they're not really feeling that bad. Their adrenaline's flowing, those muscles are still fairly pliable, and the next day or the day after is when the symptoms are the worst. So one of the problems is, even if you've helped them, if their symptoms get worse, they may attribute that worsening to you. So I almost always try to just allay people's fears, tell them to take 3 or 4 days, that I'll see them, I'll work them into my schedule, but that I want to see how things are moving there. You want to see if they have any symptoms such as nerve sensations, numbness, or tingling going down their arms. If they do, by far the safest and the wisest thing to do is tell them to get an x-ray to make sure there's not a tiny little bone chip. The odds are very, very small that they're going to have a problem like that, but you certainly don't want to be working on somebody until you know that they don't have that. So after that, we'll assume that the person doesn't have a serious, serious problem, and they're coming in to see you. One of the things I also check on is I try not to work on them the same day that they've seen the chiropractor or the osteopath. You want to be able to isolate reactions to treatment. So if they say, I'm seeing the chiropractor at 2 and I want to come in and see you after that or before, I usually say, let's work on a separate day from this. One of the things that I really see is that the fear aspect with whiplashes is as bad as almost the low back. And that is people, if you can just bring some ease into their muscles, soften the muscles, and not try to cure them or fix them, you're really doing them a real favor. But there are some things that I'd like to talk about how to work with whiplash, say a week or 2 weeks afterwards when you're dealing with this problem. So let's just take a look at the neck here. The number one thing that I work with whiplashes as opposed to other neck problems is I always keep the neck in a neutral position. And a neutral position does not mean that it's straight and that you've put a lot of traction on the neck and that you're straightening this neck out. You want to have that normal cervical curve here. One of the big problems I see with people that have had serious whiplash problems is they get what chiropractors often call as a reverse curve. They lose that lordosis in the neck, that proper curve there. So I always work in a neutral position. I start out for the first 2 times I've seen them or so doing next to no rotation or side bending with the neck. I just try to soften the outer layers, try to find areas of trigger points that are sore. With a nice soft hand, I come in and just say, how's that spot? You can almost always feel these spots yourselves, and they'll be truly amazed at your sensitivity. And you just wait there for 30 seconds to a minute until you feel that soften. If you do this 4 or 5 places in the neck, you're going to be returning proper function. The other area that I really like to work on, that I feel safe on, is the anterior neck. And this is one of the biggest problems that I've seen with people treating whiplash injuries, is most of the pain in the neck manifests itself in the posterior region. But very often the tightness are these anterior muscles, the sternocleidomastoid, the scalenes, medial and anterior particularly, and the chest tightening up. So we've gone at great length to talk about these earlier, so I'm not going to go to a whole lot of time working on this. The main thing is you keep soft hands, you sink into those anterior scalenes, and wait for softening. And try to create balance between the front and the back, and balance between the left side and the right side. Remember that the side that hurts is not always necessarily the most tight side. So do bilateral work, work for left and right balance, and take your time with whiplash injuries, and let people know that it's a very slow healing injury. The problem is that a lot of people are so surprised that it isn't better in 2 or 3 days when it didn't seem like that big an injury, that they start panicking, they start seeing a chiropractor, an acupuncturist, the massage therapist, whoever, and the body never gets a chance to just relax and heal. So a lot of the thing you can do is tell the person, say, you know, you don't need to see me next week. Why don't we wait a week and let this thing, I think you're doing much better. It's softening. You may still have some pain, but just have a positive attitude. That's one of the best things you can do for people that are injured. Rotator cuff muscles. Here again are the rotator cuff muscles. This drawing illustrates the specificity of function of the individual muscles and the necessity of very focused and specific strokes rather than just broad strokes in order to address the individual muscles that have different functions and can cause strain on the shoulder joint. I must confess that I sometimes find myself licking my chops when someone calls and says they're having some shoulder problems. I love working on shoulders. They're complex and interesting and fun and very responsive to soft tissue work. So let's talk about a little bit more problematic approach to shoulders rather than the general work that we were doing in the earlier tapes. So one of the first things I do when somebody's talking about shoulder pain is I try to determine where the range of motion is hurting. For different people, it'll be in different directions. So the first thing I do is I come down, just like I've demonstrated with P and F stretches in tape number 6. And I measure external rotation, and this is fine. Anything from about here down is absolutely fine. This is basically horizontal, and Dina has actually more than normal external range here. Then I move into internal and check. And actually we can see that from our P and F stretches earlier today that that's held, that Dina's arm has continued to stay down here. One thing I will mention, whenever you're testing anyone, if they have any instability in the shoulder or any tendency toward dislocation, almost always they will know this and alert you. But the most vulnerable position is abduction of the arm above the head and externally rotated. So if you have any questions there, always move very, very slowly. And when you come up there, then find out where is the tension or discomfort in this. Very often it will be up at the acromion right here, which means that this humerus is compressed in this direction into the shoulder joint. So one of the first things I'll do there, if I find that, is I will try to decompress this shoulder. So all I'm doing is I'm grabbing the tissue and the bone, and I'm slowly just visualizing, pulling it out of that shoulder socket, just a tiny bit. I'm not forcing anything. I'm working with these ligaments now. I can work with a little bit of rotation. I can keep this hand right there pushing at the top of the humerus now and bring the arm up and try to just have it glide down there in the glenoid fossa. So I'm just pushing it, jostling it. If I want to stop jostling and see if it'll give, there, I feel it gliding a little bit there. Very often that's enough right there that you bring the arm up and it's not compressing there at the AC joint. Okay? So the first thing I check is internal and external rotation. One of the things when people ask what's wrong with their shoulder is I sometimes will have them sit up on the table. So Dina, can we have you just sit up for just a second? And just let your legs dangle off the side here. This is a very important thing that you want to deal with all sorts of problems that people, when they come in and say, it hurts when I do this. And this is checking to see whether it hurts in active or in passive motion. So if Dina were to come in and say, my shoulder hurts when I raise it up to about here, I'd say, okay, bring it back down. And then I'd tell her to just totally relax, and I'd bring it up myself so she's not using her muscles. And particularly with shoulders, about at least half the time, this will not hurt. So that shows me that there's an issue, probably of weakness involved, rather than just a mechanical problem in the shoulder. And that's a good thing, because you can start working with softening those muscles up so that they work better, so that there's balance between the front and the back, between above and below. And then when she's contracting those muscles, then maybe she won't have any pain. So this is after you've, of course, done your work. Okay, Dina, come on, lie back down and let's talk about working on this now. So Dina is fine in her external rotation, so the internal rotation is the area that she seems to be somewhat limited in. So that means that I need to work on the external rotators so that they're free enough to let her move into internal rotation this way. So I'm not going to spend a lot of time working on the pectoralis minor, the pectoralis major, all of the internal rotators of the arms, the teres major. But I am going to work on the external rotators of the arms. So the teres minor, a lot of the rotator cuff muscles that I will talk about when we have Dina lying in the prone position. So all I'm going to start doing when somebody has trouble moving internal is try to get this humerus able to rotate internally. So I'm just going to rotate it, put it on a stretch, and start working. I'm working mostly on a fascial level there. I would just sort of just keep playing till I see that we've got a little better work there. This would be a lot of work on the posterior back here. Posterior deltoid. Anything that would restrict internal rotation. And I'm often trying to distract this shoulder, so I'm now pulling this humerus out as I'm working here. And there's a little bit of tightness right back here. So if I want to get a little bit of a stretch to that area, I can just bring her arm over, and now I'm stretching this. Is that feeling okay, Dina? Just a little bit. I noticed Dina had a little bit of protective bracing against that. So whenever that happens, I want to move them back into an area that they feel safe with, and then from there, increase that again. So now I've worked on that a little bit, and I can start pulling her arm across again. Remember, I can ask for active movement and have her reach across, and that's going to actually inhibit those external rotators as she moves across there, so that they're going to let go and lengthen. Again, I might work 3 to 4 times as long on this. I just want to give you an idea. Next, I want to check to see subscapularis and teres minor, how they're doing. So as I move this arm up, I feel like the lower part of her scapula here needs a little bit of work. As I pull up, it's stuck here and not allowing that shoulder to go up. So I'm going to soften a little bit so I can reach here, get right in on subscapularis, and I'm also going to be affecting the teres muscles here. I'm going to do an anchor and stretch stroke. So I'm going to actually anchor this. I'm not going to slide over those muscles. I'm going to grab them and then move up here. At the same time, I'm moving into internal rotation because that's the area we're trying to increase. Fingers get tired, I'll just move to knuckles. As long as I have Dina up here, I'm going to reinforce some other strokes I talked about. Don't forget that the long head of the triceps crosses the shoulder joint right down about here, and it can be very tight, and there is a little bit of tightness here. This probably comes from Dina's swimming. So I'm going to move her triceps into a nice stretch, have her arm flexed at the elbow, which is even going to stretch it more, and I'm going to work on the triceps area here. Test that arm again, see how it's moving. Where's the next chain? I feel a little bit of back here in the lat area, so I'm going to take my hand down here, and even in this position, I can work on the lat. Your fingers are very strong like this. You just grab tissue, bend them, use that arm to help you stretch that area. The other area in the prone position that is very easy to work on is just the upper trapezius. I'm going to show you more later in the seated position with that, so I'm not going to spend any time now, but this is some area that you can push the arm down and work on the trapezius area as well. But we'll do that more in another position where I think it's a little more effective. Working with the shoulders in the prone position are essentially the same strokes that we've shown earlier on in the earlier tapes, but you're going to be working much more specifically and trying to find individual muscles that are not working and isolating those muscles and extending the in range of comfort. So let's take a look at internal and external rotation when you're in the prone position. As I move the elbow up, we're moving into internal rotation. humerus is moving this way. If I move the arm up above the head, it's going to be moving into external rotation. So you need to determine where the limitations are. I'm going to continue working in this position. This is the area that Dina needs it. She needs more internal rotation. But I will do some work up above to sort of show you the other side of the coin. So the first thing I want to emphasize is that up till about level with the shoulder, that's where the arm muscles and the rotator cuff are involved. Anything above shoulder height when you're raising the arm up, that has to come from scapular movement. So you want to work at freeing the arm from the scapula and the restrictions it has there, and then to enable better movement above the head with the arm, you need to free the scapula so that it can rotate. It's just like a cam that rotates like this. So let's start working with the arm, move Dina's elbow up, which is going to move her into internal rotation, and here we're starting to get a little bit of problem there, so I'm just going to take this tissue and rotate it a little bit more and just do some nice broad strokes first. My mechanics aren't the best in the world because I'm trying to stay out of the way of the camera here, but I think you can get the idea. After you've done that for a minute or two and you feel like you've had some nice loosening, I really feel like down here in the teres area and in subscapularis is the area that I want to work the most. So I'm just going to come right in here and work on the lateral border. So my emphasis is going to be on teres minor here again, because it's an external rotator that I want to stretch. So that I can move her into internal rotation. Now we're already getting this arm moving up there easier. It's not torquing the shoulder, it's just moving. So our work is almost done in this area. That was actually pretty easy. Sometimes just some nice broad work down below here will also be good. So I'm working in the lats area here as well. It's also a good time to work on the front of the shoulder. Just have your hands working right through here and work on rotation as well. I'm just visualizing this humerus just rotating nice and easily, removing all the soft tissue restraints I feel there. Now, if Dina were limited in external rotation, I would put her up into a comfortable position with external. It may only be to here, but as I move her more and more, I could start working on teres major here, which is an internal rotator. I can block Dina's arm with my leg here so that it's not falling down. So this is a good direction here to be working. Now remember, we've got our arm up, so this scapula has to be rotating. So what I'm going to do is try to enable this scapula to rotate a little bit more by rotating it myself with my hand and then working on the lower rhomboids to get a little more length down there. So my hand's out of the way. I want you to be able to see this. You can imagine that I would still keep this going. So what I'm doing is these rhomboids are like this. I'm trying to lengthen them so that the scapula can rotate more easily and come up this way. It's a nice way to work on the lats, which adduct the arm, so they're in a nice stretch here. I can do anything I want with the lats here. And now that I'm up in this end, let's go back to work some more on internal rotation and letting this scapula rotate this way. So I'm going to work on the upper rhomboids now because I want them in a stretch. So as I rotate the scapula this way, we're stretching the upper rhomboids. And then this is just a wonderful area to work on infraspinatus and supraspinatus. Great access to the rotator cuff. A lot of people get a little bit sidetracked on exactly who the rotator cuff band is. And the acronym that I use is SITS, S-I-T-S. So you've got subscapularis, infraspinatus, the I, T, teres minor, and S, supraspinatus, right up above the spine. So this is a great area to work on this. And let's go back to our friend the fist, which we've spent a lot of time with earlier, and this is a nice broad way to work on the scapula. And this is also another great area to just start working on this trapezius. I still am going to work on the trapezius in the side lying and in the seated position to show you how to work on that, but this you can start doing a little bit of work right now. And just expedite this by taking your other hand and pulling the shoulder down. Or if you want to inhibit the trapezius muscle, have Dina just reach down toward her feet, and then neurologically that's going to inhibit that upper trapezius muscle. So that's helping you out to lengthen that muscle. Let's move to some brief side-lying strategies with the rotator cuff, and then we'll move to some rehabilitation exercises. Let's just give a quick review of some of the ways you can work in the side lying on the shoulder. If you've done the other two, the prone and the supine, you may not need this, but it also might be a way to skip either the prone or the supine, depending on what you're feeling in the shoulder. So let's just give a quick review. I'm not going to go nearly as slowly as I would if I were actually working very, very precisely on these. So the good advantage of the side lying is you can work on the arm and the shoulder in both internal and external with very little change here. So I just have Dina's arm starting way up here, and I just want to remove any restraint that's down below the scapula here in the lat area and in serratus anterior and serratus posterior. Serratus posterior is a really good muscle group to work on here. Just work with the breath here. The biggest advantage to working in the side lying is really for anterior-posterior movement of the scapula. So all I need to do is take Dina's arm and rotate it just a little bit here. And then I can get on the anterior border of her scapula, grab it with my thumb, roll it open here. Somebody that's got their scapula pulled together very, very close to the spine, with a very erect military posture, you won't be wanting to do this. But somebody that's a little bit slump-shouldered or has been doing a lot of lat work, doing pull-downs, this is a great way to mobilize this. If you need to work more specifically, just come in with your fingers and pull this back and work right along that border here. By the same token, if they're really, really tight, as I was saying, if they've got a military posture and their scapula are pulled toward the middle, then you just reach the arm out, which is going to pull the scapula this direction, and then you can work anywhere along the rhomboids here. Basically, we're just freeing that scapula. There's a little bit of a hunching going on with the shoulder here, so all I'm going to do when I feel that is just move my body. Don't get hooked into any one strategy. Bring her arm just a little bit further down this way, and then I'm going to work in this direction by pulling the scapula away and do a separation stroke. And again, this is a great way to lengthen the trapezius muscle here. So I can do a separation stroke. So I'm moving in opposite directions. I'm pushing the shoulder down as I'm moving this way over the upper trapezius. Or I can augment letting go by moving in the same direction. And you can sort of maybe even see with my hand how we're rolling over something pretty tight here, possibly even levator scapula. So I'm going to slow down, downshift, work slowly, and just wait for that melt there. I'm going a little bit across fiber, so now I'm going to go in the direction. You can even do a little work on the deltoids this way. You don't want to work real heavy here because you're compressing a lot. But this can help bring that humerus to drop out of that glenoid fossa a little bit. Okay, let's talk about how to work with some strengthening and stretching exercises for the shoulder. As I've recommended, I think it's really a good idea to find somebody that really knows their kinesiology, a physical therapist, an athletic trainer, or somebody that you trust, a chiropractor that's willing to work with you with strengthening and stretching exercises. However, I've had such good luck with shoulder strengthening and flexibility exercises with my clients over the years. I want to show you some quite safe, although somewhat generic, shoulder strengthening that you can try with your clients, and then if it doesn't work, they can get more professional help and more classic medical ways of approaching this. So let's talk about flexibility first with Dina, and talk about a couple ways to increase flexibility so that shoulder moves a little more easily. So if we've already talked about with Dina, she has a little bit of a problem with her right arm on internal rotation. This is the area we always seem to be running into problem with her. So I want to just demonstrate a way of testing that internal rotation. Dina, if you can just turn around. Remember, when she's lying on her back, we can just have her arm out and test this way or this way to see. But this is another way. Dina, why don't you, with your left arm, reach up as far up as you can your back. Okay, so look, she's very good there. That's far better than average here. So I'm going to hold my hand there and bring your arm down. And now take your right arm and reach up. Okay, so we've got, 5, maybe even 6 inches of difference there. So this goes right along with what we've been figuring out there, and this is a perfect way to work with your client to show them, look at the difference here. We need to have you really work on this stretching idea. So this is a great way to work on that. They're all going to say, oh my gosh, I never even realized that. So let's show Dina. She's done this exercise for swimming. If you can take your other arm and grab, she can work with her upper arm and pull this arm up. And you do want to work both sides, but you might want to spend 2 to 3 times as much on the other side. Now let's try that from the other side, Dina. And she can't quite touch there. So this is where you put Grandma's tie to use that she gave you last Christmas. And that is, you just give a tie or some other article that she can grab, and you have her sort of inch her way up with the bottom hand and then make that arm nice and relaxed. And all of her force is going to be from her upper arm, pulling this up and trying to keep that elbow back. And the main thing with this is you do not want to overstretch when you give these. Tell these people that they're doing this, that if they can get another inch or two in 2 or 3 months, that's ample. So the biggest problem I have with this is a very good exercise is that people get a little bit too type A, and you have to tell them to do it at about 50% of what they want to. It should always feel good. And you just have them hold that for about 30 seconds, let it come down, shake it out a little bit because you don't want this to seize up. Just take your arm and just shake it out, grab again, and then pull that up. This is a good stretch for virtually anyone. It's basically a yoga stretch, and the other thing is, do this when you're warmed up. Don't do it first thing in the morning. I sometimes tell people to just have a wash rag in the shower when they're nice and warm and they've had water running on that, and do it that way. You don't want to overstretch this. That's the biggest problem with stretching for shoulders, is people getting a little bit too ambitious. Okay, Dina, why don't you turn around and we'll talk about one other stretch. And this is just having her ability to reach across her body. So she keeps her arms straight. You can bend it, but I think it works a little better with the arms straight. And you don't bend your body, so she's not going to be pulling her whole body around. She's going to keep that facing straight ahead, and then that's going to stretch all this deltoid area, all these external rotators back here, and be bringing the scapula around this way. And that's an excellent stretch right there, and a very, very safe stretch. Okay, that's flexibility. Let's talk a little bit about how to work with strength in the rotator cuff. Let's cover about 3 simple strengthening exercises that can also really help return a shoulder to normal functioning. Again, these are somewhat generic, but I think they can really help you, and normally your clients will respond within a week to this or even less. And as I say, if this doesn't do it, then you send them to somebody that's a little more skilled and a little more specific. So let's talk, rather than talking about a lot of specific muscles, let's just talk about the motion here. So this is a great test to see how strong the posterior scapular muscles are. So the key on this is you want to have the thumb pointed straight up toward the ceiling, and you want to have the arm coming up perpendicular to the body. And come back down and watch this 2 or 3 times. See where things seem to be hanging up. See how easy it is. People that are having trouble with this, their arms are going to be shaking. They're going to not even be able to bring it up to horizontal here. Okay? And so what you can do is, this is a great way to, again, to show people that they have a weakness in this area, is almost always the shoulder that has not been working well, that is painful, it will be twice as hard to raise this. And you say, you know, you just need to get some better balance in this. And it's very easy work. And the key to this, again, is you don't do anything that's painful. If your client's not as strong as Dina is, and they can only go up to here, that's fine. Work up to 3 sets of 10. And then if need be, you can raise up to 1 pound or maybe even 2 pounds, but usually 1 pound of weight is about all you need. So somebody might only be able to go up this far at first, and that's such a great way to see them improve, and the next time they come in, they may be able to bring it all the way up. After they've got it brought up to horizontal, then you can have them start raising it higher. And what that's going to do is strengthen the rhomboids and the muscles that stabilize the shoulder blade on its medial border. And the main thing is, you never have anybody do anything that's painful in this position. If they're a little bit painful up in the AC joint, the acromioclavicular joint, just have them bring their arm down just a little bit so it's not totally straight out, and they can bring it up here. Okay, let's talk about a couple more with Dina standing here. Okay, the next one I want to talk about is the motion of supraspinatus. And what you want to do is, it's very important on this to isolate the supraspinatus and to not use the trapezius muscle, the upper trapezius muscle. This is where Pilates work is really great on detraining this trapezius. If you see some people with tight shoulders, have them do this test, and I would bet you 3 to 1 odds that when they initiate this movement up of their arm here, that it's going to be initiated with the trapezius muscle. And I may even have Dina sort of fake this to sort of show what that's like. Now the key on this is you don't do it straight out in front of the body. You don't do it straight out to the side of the body. You do it out at 45 degrees. And the first thing you notice is, where does this trapezius start grabbing in? Okay? Dina's got this down. She's been doing all these swimming exercises, and she's perfect about this. But maybe you can just sort of initiate with this, and you can see, there we go. You'll see the exaggeration there, that this trapezius muscle initiates that movement. So what you do is you just train your client to put their hand here and only go as far up as they can with that trapezius staying soft. And if it starts grabbing here, you go back down, and you just keep working until they can bring it all the way up like that. When they can do 3 sets of 10 with that, then you can move to, just as Grandma said, chicken soup. Just get a soup can, and it's really good for virtually everything. And that's about all the weight you want to use. If you start using more weight than that, you're going to be calling in the large muscle groups. And this is to train the small muscles. Okay? This is a very good exercise, and it's another one that you'll find that the troublesome shoulder, you have a mirror in your office and you show them that shoulder jumping up, and almost always the troublesome shoulder will jump up and the non-troublesome shoulder won't. And if you really need help detraining that, the Pilates is great work for that. Just 1 or 2 sessions with the Pilates person and have them do some abdominal strengthening as well, and your people's money will be very well spent. Let's do one other strengthening exercise, and that's internal and external rotation. Almost, I would say, 3/4 of the problems that I see with shoulder function have to do with weak external rotation. But let's just start since I'm on this side. What you want to do is make sure they're using the rotator. So I put a pillow or a towel or something right here and have them hold it here and make sure that they're not turning their body again. All of this should be internal rotation of that humerus. And all you ever do is attach the other end to a stationary object, possibly tie it to a doorknob, and have a rotator arm across the body. Only go to the point that you can do this without pain. As she gets stronger with this, then you could double this up. You could have her grab the other side, and now she's doing twice as much. Okay. On the other side, if she's nice and strong, has great strength in her pec major and all those internal rotators, you don't even need to do this. The one that most benefit comes from is an external rotation. Okay? And you can even notice just at the same strength here that Dina's having a little more trouble here. There's a little bit of shakiness in the way her arm moves. She's having to fight that a little bit more. So it wouldn't really do much to have her do the internal rotation. She's perfectly strong there. And as you get better with it, you might even have her start all the way over here and work through that range, whatever range is difficult for her. This is an excellent exercise to use, so give this a try with your clients. I'll tell just a very quick story. I had a father of physical therapists that I had in one of my classes, and she sent me her father over to me because he was having shoulder problems, and he was over 80 years old, and he plays tennis 7 days a week. And he came in and he wasn't interested in getting regular massage. He said, I just want to find out how to strengthen this or how to stretch it. And so we worked on a home program. He went back and he started beating all these people that he'd been losing to, and pretty soon I had this parade of octogenarians winding their way up to my doorstep because they had needed to get back in shape so they could beat him again. So it really does work, and it's really gratifying to make somebody realize that they're in charge of their destiny instead of having to come to you or someone else every single week. And it will pay off because they'll be referring other people to you. So play around with these ideas when you feel ready for it. They are very, very helpful. In this next segment, I'm going to combine carpal tunnel, tennis elbow, and golfer's elbow because the treatment of all three of these conditions, the treatments really overlap. So let's just talk about the forearm and the importance of working on these, and then I'll talk a little bit about these conditions while I'm working so you can see me work. Most of these have already demonstrated, and the difference working with somebody injured would be that you'd work a little more slowly, you'd keep away from the specific acute pains area, and work more on areas downstream or upstream from that to increase flexibility and mobility. So let's take a look at the forearm here. So let's start with tennis elbow, which basically comes right about here, and this is the attachment for all the wrist extenders. So when they contract, they go here, and if this gets very, very short, or if there's a lot of tightness on the other side, they get overworked and get fibrous, and then that shock comes all the way up to here. So what I want to do is talk about some of the ways I work with this, with the other side of the coin, which is golfer's elbow, which comes on the inside here and has to do with tight forearm flexors. And then we're also going to talk about carpal tunnel when we're working in this position. So there again, this is nothing special. There's no magic tricks to this. One of the things that gets upsetting is that I've seen some advertisements for people promising secret special ways to, in 3 sessions or 3 strokes, that will cure carpal tunnel or some other problems like that. And it's really important that you consider that you have to address the cause of these problems. If somebody is chained to a computer for 12 hours a day, like some character in a Charles Dickens novel, you're not going to cure their carpal tunnel with 3 easy moves. But you can increase their flexibility and hope to improve their symptoms. So let's go back to talking about tennis elbow. In addition to the wrist extenders that you want to stretch, you also want to work on supinator, which attaches here, and when it contracts, it pulls this radius into supination. So all you do is you look for fibrous areas, go up until you feel the pain area, and then you're going to be really careful about that. You don't want to overstimulate that. A little bit of cross fiber work, particularly if you have some ice to work on it afterwards, is fine. But what you want to do is just continue to work downstream from that area, work into stretching supinator by moving the forearm and the wrist into pronation, and soften that area. As you get better and better at softening this, and as you're improving, then you can get closer and closer to this area. I do always do a little bit of surface work to try to get this area back into a feeling of less defensiveness. So I'm going to work on this, but I'm always going to be very, very cautious. When I feel any tension or recoiling against my work, then I'm going to back off. Remember, you can stretch these extensor muscles by flexing the wrist into flexion. So we'll review a couple of the strokes. I can anchor wherever I feel tension and then move away from there to get a stretch. I can expedite that stretch and maybe move into pronation a little bit by doing the same thing. And we do just the opposite on golfer's elbow, which is right here. So all I'm going to do is start in a softened position here, supinate, so I'm stretching pronator teres, and extend the wrist, so I'm stretching all of the wrist flexures. A lot of times I'll just, particularly for carpal tunnel, I'll just work with this wrist and try to distract it, compress it, find out how can I get some movement in here and soften this. Just be very, very gentle with carpal tunnel. I do try to picture the carpal tunnel as being compressed a little bit through here. The median nerve comes right through there, and I try to open this up and basically expedite the movement of this wrist in this area so that this is not compressed here. So I will do work, not right over the median nerve, but I'll just try to soften this. Somebody sitting at a keyboard with their wrist flexed like that, you just want to increase that ability to flex without overstretching that nerve. And then remember the stroke that we did way, way back, and that's facilitating shortening. So let's do some work here to enable this wrist to shorten. If we can make this wrist move more easily up that way, then it's not stretching and fighting this tissue as much. And I go bouncing back and forth so I'm not overworking one area. Then I might come back here and work on other movement areas that I feel any tension at. If somebody comes to you and says they have carpal tunnel, Be sure if you can to get a diagnosis, because it really requires a physician or a neurologist to differentiate between carpal tunnel syndrome, between wrist tendonitis, or thoracic outlet syndrome. And it doesn't have to be one or the other. It can be thoracic outlet syndrome along with carpal tunnel. Sometimes there's a tendency to simplify, say it's one thing or the other, and then what you can really work with is some of the inflammation associated with tendonitis that may be impinging that nerve as well. The main thing is you're not going to be curing serious problems like carpal tunnel by just working away and softening tissue. You have to address the cause. The thoracic outlet. This drawing beautifully shows how any force that either pulls the clavicle down or pulls the ribs upward can compress the circulation and nerve plexus in the thoracic outlet region. It also explains why holding the arm above the head for extended periods of time can crimp the nerve and circulation. Let's spend a little time with the thoracic outlet. This is another condition that has a medical diagnosis that sometimes frightens massage therapists when a person comes in and says, I have thoracic outlet syndrome. I think the key word to think about there is syndrome, which is a combination of symptoms. And so it's not necessarily one specific thing. It can vary from person to person. What you really want to do is just create better balance, better ease in the shoulder girdle, particularly in the anterior aspect of the clavicle, the sternum, the anterior neck muscles, and the first rib. So let's take a look at this area. The anatomical issues that are involved with this is all these nerves that come down the arm, the radial, the ulnar, and the median nerve, they exit the spine and they have to travel down through here and over across here and down the arm in varying ways. And there's so much soft tissue that can start impinging this, and there's also a lot of osseous problems. The clavicle can be a little bit seated too low. The ribs, more often than not, are pulled too high up so that they're compressing this area right along the clavicle here and right along here in the scalenes. So we're going to go back to actually what we were talking about very, very early after we had just covered the fundamentals of deep tissue massage. We basically want this upper shoulder girdle to relax and start moving. And that means we have to work with the tissue, and then we also have to work with the ribs. So initially, I'm going to focus mostly on Dina's right side, but when I first start with people with carpal tunnel and thoracic outlet, they have had a lot of problems and they're painful, they've had tingling, so I want to start with their confidence. So I just do some nice broad work to their chest, trying to open this area up, because very often it's pulled together here. Wherever I feel tension, I stop and I soften, even if it's nowhere near the thoracic outlet. After I've got that a little more and I've got that softened, then I'm going to switch to the ribs, and I'm going to feel, how are they giving? Remember me mentioning in the earlier tapes about the ribs being piano keys. You should feel each one being independent here. So I can feel each rib and say, oh, this one's not really moving. Get on that rib, start moving it, compress it into the sternum, pull it out, and start working with that rib. When you get individual ribs taken care of, then you start working as a group. Very often these ribs, because of people that do a lot of breathing up to this area instead of filling up their stomach, these ribs will be pulled up way, way tight against the clavicle here. And all you really want to do is mobilize them, allow them to drop. This is a great way and time to teach people to do some abdominal breathing, as we talked about in the earlier tapes. I'm just basically trying to get this area to open up and relax. So the next area I move to are the anterior and medial scalenes. You certainly can work with sternocleidomastoid, but I think the scalenes right down around the clavicle are probably the best way to work with this. And so what I do is, depending on how tight they are, if I feel there's some laxity here, I can actually rotate the head and put it on a stretch to work on these scalenes. Here I'm stretching, anchoring, and moving away. But if they're too tight and too tender, then you're going to want to soften. You may even want to raise the head a little bit or even use a pillow. Okay, and just make sure your client isn't helping you because they're going to be tightening those muscles. So let your head be nice and heavy, Dina. That's great. Dina's so generous. She's trying to make my work easier, but she's contracting these muscles here to do that. So now they're a little bit softer. I've shortened them. I've moved her head forward. And what I'm doing is, you know, these scalene muscles attach down to the ribs. If I can lengthen these muscles, these ribs can fall. So I want to do my homework with the muscles first, because then I'm going to address these ribs again. As I feel like I've made some progress, then I can start stretching, moving her this way. Just wherever you feel tension, work there. This is another area where I often do P and F stretches. I'll get the head in a neutral position, and I'm going to give the image to Dina that she's a turtle and she's pulling her head into her shell. And what that does is, these are the muscles that are tight that you're trying to let go, and this gets her awareness there. So Dina, just pull your neck in just like you're shortening your turtle, and I'm working against her there. I wait for 6 seconds and then tell her to take a nice breath and relax and let all those muscles go. And then put that neck on traction, and those muscles will then learn how to relax, because sometimes they don't even know how to do that. So this is another thing that's pretty nice PNF stretch to work with. Once I've got these muscles softened, and I might spend up to 20 or 25 minutes working on these muscles. You don't just do a superficial job. You work slowly. You don't force them to relax. Then let's go back and review a little bit of the first rib mobilization techniques that we used in the earlier tapes. The key on this, and I'm doing this a little faster than we had before because I'm assuming you've already seen this, is you've let your thumb slide right over that anterior border of the upper trapezius muscle. You find that rib, and it'll be almost like this. You'll just feel a nice flat surface there. And then I just start playing. I start rocking. There's no set way to do this, but I try bouncing back and forth. I try rocking it. So I'm actually turning it like this and like this, any way I can mobilize it. And sometimes all I do is just hold it with about 4 or 5 ounces of pressure and just wait and see if it'll soften and drop. There we go. A little bit of a softening happened there. The other thing you can do is use your thumb as a fulcrum. This is not going to wear your thumbs out. This isn't a real muscle move. You use that thumb as a fulcrum right on that rib, and then you bend the neck into that area, and there we feel that rib give a little bit more. Okay? And the only other area that I really focus on with thoracic outlet is the pec minor, which is going to be right about where this clavicle comes and meets the shoulder here. Pectoralis minor. It is easily seen from the drawing how a short and fibrous pectoralis minor could pull the scapula too far forward, or even pull the 3rd through 5th ribs in an elevated position to compress against the clavicle and put pressure on nerves. And I'll just come down with 1 finger or 2, and I'll get right on that coracoid process. I'm going to get my hand out of the way so you can see. This is a little bit more sharp than I would like to work, but I want my hand out of the way. And I just wait and imagine that pec minor is pulling this scapula forward. I'm just going to wait for it to soften. And visualize the shoulder just dropping back and falling like that. Okay? And then I'll finish it up with some work along subclavius, the muscle that runs right along here. And I'm always telling people when I work on thoracic outlet, at the first sign of any numbness or tingling to let me know immediately. It doesn't mean that you're harming them, but you don't want to continue irritating that nerve. And you want to reassure them that a little bit of numbness or tingling is not going to be harmful to them, but that they should let you know right away. Some people just assume that's energy flowing through there, and I think it's much better, even if it is energy, to play it safe and take a little different grip and work in a little different area. So I might spend 4 or 5 minutes right on subclavius here, just working underneath that inferior border of that clavicle. And after I've done that, I might do a little balancing work by just grabbing the clavicles, moving them around, trying to mobilize them, rotating them like this or like this, compressing them, distracting them, and work like that. If you walk carefully, cautiously, and slowly, this is wonderful work for people with thoracic outlet. Not that you're necessarily going to cure them in 1 or 2 sessions, but you can really improve their condition. One of the things, as I've mentioned earlier, is if you can improve somebody's condition to the point where they can feel what's setting them off and what's causing this, then you've really given them a benefit because they can eliminate that behavior. Let's move to some fun work of working in people up in gravity, sitting in a chair, another dimension to your work that can really broaden your work and increase your professionalism. Most of us in the massage business have had this happen. If you haven't yet, I guarantee you will. You've done great work, the person's been raving about the work, they get up off the table and they've got a kink here or they've got a kink there. This can be a form of controlling behavior to try to get a little bit more work in, but very often it's just the old patterns are at conflict with this relaxed body you've given them, and they stand up in gravity and their old patterns of tightening come in, and all of a sudden they're feeling more uncomfortable than before they walked in. This puts you in the dilemma. Do you have them take off all their clothes and get back on the table to work on that, and then possibly have them get off the table and have the same thing happen? Or can you possibly work on them in another situation where they don't have to take off their clothes and you can really help them work with gravity? This is why I love working in the seated position. There's a lot of options here. And the other thing is this will transform your practice into a little bit more structural and functional aspect. It's very, very important that people learn how to move up in gravity rather than just lying on the table. So this will be something that will separate you from the rest of the masses out there that are doing all the work with 1 or 2 moves, never turning anybody inside lying, and once you're done with the massage, that's it. So consider learning to work in the seated position and even in the standing position. It'll be great fun for you, it'll expand your practice and your professionalism, and will pay off in many, many ways. So let's talk a little bit. Dina's sitting on a stool here that I use in my Rolfing practice. And one of the first things that I see when people stand up after a massage where they've been nice and relaxed is the trapezius muscles. They've also started to use all these muscles here that they haven't had to use. So let's just talk about the trapezius. This is also a very important area that you can work with when you're working with some rotator cuff problems. So I'll bring that in a little bit. The main thing is, as soon as they get up in gravity, these muscles forget how relaxed they are, and they shorten and they pull up the shoulder. So what I'm going to do is just work with her on letting this come down. Dina's got a swimming suit on, but you can actually do this right through someone's clothes. And all I'm going to do initially is keep her in a neutral position, tell her spine to stay erect so she's not going to side bend, and just start working at lengthening this trapezius muscle. This is something that's not as easy to do in a conventional massage chair. The person still is resting on that chair and you're not dealing with their proprioception and their postural patterns. If you feel this go right there, then that's enough. And very often people say, oh, that feels great, and that's all you need, and you've done 30 seconds work. But if you need a little bit more, you can be much more specific. You feel some trigger points, things like this. And what you can do is call them into this, because if Dina bends her head to the right, that's going to be sending neurological signs to this upper trapezius to let go so that she can bend it to the right. Her right trapezius is contracting along with some of the other muscles that are involved with side bending there. So now I'm working in the direction of lengthening. And come on back up to neutral again. And then I start getting a little more specific. Dina, I want you to just bring your head forward a little bit. Now I can work on levator scapula. And rotate your head to the right so that your left ear is coming down towards your knee. And let your head fall. Any areas that you feel tension, okay, and bring it back up again. Then we're going to do a little bit of integrative work here. Start working along this scapula. Bring this down here so her shoulder can fall back. And of course you would balance this with the other side. Take a nice breath, Dina. Notice how the breath is coming into this area. Just sort of get their awareness back there. That might be all you'd need to do. Now, if you're really doing body work, where you're working with posture and changing patterns, you can spend up to 20, 30 minutes working somebody in the seated position. Let's talk about some other advantages to the seated position. If I have you stand up for just a second, Dina, I'm going to turn the bench around. Now I want you to just lean against the table here and curve your back. Good. Okay, so here's this problem that I see the way Dina is curving her back here. This might be the posture similar to what you would have in a massage chair. But she's a little short through her abdomen. She's sort of compressed in that area. So I sometimes just give the cue of lengthening through there and lifting while leaving your head down. Leave your head down, Dina, that's good. And just think of a cobra. You know how a cobra rises and spreads? There we go, that's that view. So now she's got like a lot of length through here. She's also got some support from her abdomen, getting some lift out of the pelvis here, and then I can do anything I want here as far as lengthening these muscles. The advantage to this is that, as you can see, these erectors and all of these muscles are on a stretch now because Dina's forward bent. You want to make sure she's not rocking too much, but I see a lot of people abusing their own bodies trying to work bilaterally here. And I don't think it's necessary. You go wherever the tension is. You can be very, very specific. You can go right down the spinal groove, anywhere where you feel tension here. Work for balance. Check and see how these ribs are moving. Is there any area here that isn't moving? I feel a little bit down here. It's a little tighter, so I'm going to work on that area. And breathe right to my hand, Dina. Great. There you go. So she's learning to breathe way down low here to these ribs when we do this. And I can continue this all the way down as long as she's feeling good in her low back. I can take both my fists here and just breathe way down here. That's it. Tip your pelvis under just a tiny bit. There you go. I can work all the way down to the sacrum this way. I can work along the crest of the ilium to widen this here. So this gives you a great way to work on the back in a curve. We've talked about the side-lying C curve, and that's a fine way too, but this we're working at getting some length through here so she's not collapsing, and this is going to help her a little bit more. Okay, sit up for just a moment, Dina. And I'm going to slide this back just a tiny bit. And let's talk about the other way. It's very, very hard to work the thoracic spine in extension, which is moving back this way. So what I do on this, I want to protect my own back, is I just have Dina put her hands behind her neck and a little bit lower, and then bring her elbows as much as she can together and be comfortable. And then I bring her forward, and I use my hand as a fulcrum here. And I open her up this way. People love this. I can take a nice broad stroke down the spine. At the same time, I'm really opening that chest up just by stretching it. This feels wonderful. If you feel one particular area, the vertebrae aren't moving, see, I'll actually turn from side to side, then you get much more specific. Always be sure to have her tell you if there's anything that doesn't feel right. And then bring her up. That's really going to open up the chest area. People love this. They feel like they're about an inch or two taller. This will be all open. This has been moved into a nice extended position without having to work with all these muscles. And she'll have a great feeling of lift here. Working in gravity in the seated position is also another great way to add that finishing touch to your shoulder work when you've freed up this shoulder girdle. So let's just take a look at a few other things that are very different when she's sitting or standing. Her use of her shoulder patterns will sometimes come back. So let's just take a look here. Basically, you can work anywhere on the rotator cuff, and she'll learn to just let that shoulder drop. The biggest problem I see with shoulders is that people raise that scapula up. You can get right along that upper border of the scapula and just let it drop. And the other advantage of the seated position for the scapula is I've impressed on you the importance of detraining the upper traps and how Pilates and other physical therapy exercises can really help with this. One way that you can train this is that, as we did with the exercises, Dina's supposed to bring her arm up like this and keep her shoulder down. So all you need to do is just put some pressure down on that trapezius and go ahead and raise your arm up, Dina. And that's, for all practical purposes, going to shut off that trapezius. So she's got to learn another way to raise that arm up. And back down, and raise again. And back down. The other thing that this is also a very good position for is accessing the medial border of the scapula and expediting its ability to move out as you're reaching across the body. This would be for somebody with very tight rhomboids. Dina's actually aren't that tight, but all I would do is have Dina raise her arm to shoulder level and then bring it across her body. And at the same time, I'm expediting that and preventing her whole body from turning and just freeing that scapula to move this way. That's something you can't get when you're lying on the table. And bring it on back. As long as I'm here, let's do a little work with subscapularis. I can access her body a little bit more easily like this from this side and bring my hand in, but you're not going to be able to see. So I'm just going to do it this way. I'm just going to get my hand right here, let your arm just drop, Dina. I bring this back, and I can get way underneath those ribs and work on subscapularis, and then I can start rotating the scapula here. You can see I'm actually up past my second knuckle here. And anytime I feel tension here, that's where I can work. Let that fall. Great, great. So utilize that seated position. It can add a whole new dimension of expertise to your practice and add fulfillment to your work. Well, there you have it. I hope this has been an enjoyable and educational foray into deep tissue massage and myofascial release, and that these videos will be worthy of revisiting many times for you. I must confess that I struggled with the issues of presentation of the information. Some people feel more comfortable in their learning by being shown well-scripted strokes or rote routines, and it certainly would have been simpler to have presented information this way. But I really don't think that's what massage is about. Any strokes and strategies are only useful in the context of your client's needs, and the surest way to lose your love and enthusiasm for your work would be to perform a perfunctory or unimaginative stroke or strategy. Remember, a stroke can be an empty gesture without intention. I began this series by talking about the importance of your touch, and I want to return to that subject. Please remember that in real life, I work much more slowly than most of the demonstrations in this presentation. No video can express the humanity and care behind the touch that I've tried to demonstrate. And really, this is what separates us as massage therapists from mechanized massage machines that are for sale. It does take a while to ingrain these techniques and strategies into a smooth and comfortable style that you don't have to consciously think about. I really hope that the knowledge you may have gained will just add to the vocabulary of your skills and enable you to better express your humanity and compassion for your clients. May you always remain fresh and enthusiastic in your work and continue to grow and cultivate your skills. We are so lucky to be in a profession where we can continue to learn and improve for as long as we work. Thank you very much for your interest in this video and in expanding your skills. And good luck with your career in bodywork.